Good afternoon, this is Media Center, Ukraine, Odessa. We continue for today with the briefing dedicated to the assistance to the Odesa ophthalmology center that was damaged during missile attacks on the 14th of June. Our guests are Ruslan Shchipun, co-founder and director of the Tarus Laser Vision Correction Center, and Serhii Shchipun, co-founder, chief physician of the Tarus Laser Vision Corrector Center, candidate of medical sciences. I'd like to give floor first to Ruslan Shchipun. Can you share the details of what happened with your ophthalmology center? Good afternoon. On the 14th of June, as everyone knows, there was a tragedy in Odessa. One of the missiles launched by Russians from the water area of the Black Sea hit the business centers in Shevchenko Prospect, Shevchenko Avenue, and that led to significant damage to the building. And fortunately, no one was killed there, but people working in other areas of Odessa because of other missiles. Unfortunately, because of the attack of the building in the Shevchenko Avenue, our Tarus Laser Vision Correction Center was damaged significantly because of the missile strike. We've been in that building for the last 15 years, and 2 months ago we celebrated the 25th anniversary of our center, and this is the first private ophthalmology center in Ukraine, and big amount of unique surgeries were held there for the first time in Ukraine. And in the 19th, the laser correction, vision correction was made for the first time for Ukraine, and my father can share more details. Serhii Shchipun, the candidate of medical sciences and co-founder of the Tarus Ophthalmology Center. Our center was founded to introduce the latest achievements in ophthalmology, including surgeries and equipment. Back then, there were no visual corrections of vision back then for short-sighted patients, for example. So the task of our center was to introduce new technologies in Ukraine and to assist patients, for example, that were short-sighted. And that also allowed to cure inherited cornea diseases, that allowed to avoid cornea transplantation in some cases. We started our cooperation with the Filatov Institute, and together with Cornea Transplantation Department, we developed the technology to cure inherited cornea dystrophy. We also introduced other laser technologies. We purchased unique equipment that was the laser to cure glaucoma, and also for retina surgeries that allowed Ukraine to become one of the leaders in refraction surgeries. We were one of the first to transplant cataract using flexible lenses, and that allowed to shorten a stay of patients in hospitals. And now these are outpatient surgeries, like it is in leading clinics and centers in the world. We always follow the latest achievements in ophthalmology, both when it comes to science, and also equipment. We are constant visitors of different meetings and conferences of ophthalmologists in Europe, United States, and in other countries of the world, and we try to introduce in our center the best techniques. For example, we treated the inherited damages to cornea, and we used special lenses that allowed to have, after so-called cross-links, the treatment of keratoconus, and we allowed to rehabilitate these patients, and they achieved good results without transplantation of cornea. Apart from that, we introduced the latest achievements of the ophthalmology in terms of equipment and science. We used all the possibilities that we have to increase, to ensure a better vision in our patients. We also provide medical services to our military. We worked together with the ophthalmology department of the military hospital, and I would like to share more details about that. And here I would like to share with you more details. For the last 25 years, we, as it is known, closely cooperate with the ophthalmology department of the military hospital number 411. At some period, we even used their premises, and after that, we've had long-term relationship with the hospital. Those soldiers that could not be aided with traditional methods that could be offered in the hospitals were referred to our center. We made vision corrections and the great number of vision corrections and other types of treatments were free of charge. And since the first day of the active phase of the military action, since the 24th of February last year, we have been supporting the mentioned hospitals with medication, antibiotics, and with all other resources that we had to help to overcome the first wave, because the hospital was not ready to cope with the big amount of patients. We also cooperated with the volunteers to supply surgery table to the admission department, to the hospitals for the primary examination of the military. I would like to thank Igor Akhstachov and Diana Spisens, who supported us in that project. Since the 25th of February last year, we disseminated information through internal chats about providing free of charge contact lenses and glasses to our military. And for the first several months, we just emptied our warehouses to provide lenses and to provide glasses to the soldiers from different units. So we cannot assess the amount of our aid, but we can just say that our warehouses became empty. This means that we did everything possible to support our military when it came to ophthalmology. I would also like to say that over the 25th years, we have introduced all modern technologies the state-of-art technologies following the world global standards. We have visited almost all possible international congresses, and for the first time we introduced IDEA Swiss lenses and other star LCL lenses, allowing us to treat patients with the abnormal diseases, and we helped a great number of patients who could not get laser treatment, but we were able to restore their sight. And now I would like to briefly tell you about what happened a week ago, on the 14th of June. Caliber missile, as we know, hit the business center building, significantly damaging the building itself and the first two floors where our center was. So they destroyed our infrastructure for the diagnosis of pre-laser correction, and the explosion wave went through the whole building, leading to significant damage to the whole building. A significant amount of equipment was damaged for diagnosis, for anesthesiology, for surgeries, let alone different type of furniture and screens, etc. Almost everything was destroyed there. And now I would like to tell you about what we're doing to cope with the aftermath of that attack. With the help of volunteers, with the help of God, with the help of our friends, we've managed to find new premises where we now transport the preserved equipment. Moreover, it is very important to say that the whole staff of our center are alive and they're safe and sound because it was during night time and nobody was there. And they are very optimistic and are looking forward to restart their work. And we are also assisted by engineers. Yesterday we had 3 brigades, 2 brigades visited us today, and they also examined the equipment for further repairs. First equipment is sent to Kiev, then in Germany, then in Switzerland, to restore the equipment where it is possible. We have been negotiating with the suppliers, and we feel their support, and we are very thankful to them for this. And they are ready to reimburse the losses for some of the equipment, and they also are ready to provide some equipment free of charge for a period of time. We also hope that we will be supported by the city, by the municipal authorities, international institutions, and foundations, including those of medical ones, and we hope that the situation will not be unnoticed by them. It is quite difficult now, but we still have a hope. We have also created a website, help.tarus.ua, where we inform Odesa residents, all our partners, friends, and patients about what have happened, how we are restoring the center now to be able to support the patients under treatment. We have a lot of elderly patients with diabetes that require systematic treatment and that require systematic intake of medication, and also microsurgeries, which shall be carried out in a center in specific intervals. And that's why our task is to restore the clinic in 2 weeks, at least the diagnosis department, and we'll be able to do this. Unfortunately, surgery department and other units require more work, but we hope that we will be able to restore fully our work in 2 months. On the website Help Tarus UA, we have published information about bank accounts in Monobank. We also inform about money that we are able to raise, and we are very thankful to all Odesa residents who support us morally and physically. We are ready to accept any type of help, including that of volunteers. During the first days, our neighbors, people from neighboring houses, just helped us there to clear up the debris. And you cannot imagine how thankful we are to these people. And we hope that thanks to this, we will be able to restore our work in the nearest future. I would like to thank all people who help us, and also these are our patients or families of our patients, and they understand that our family business is very important, and we need to restore it the whole world. We're thankful to all your calls, to all the information which is provided. We accept everything. We'll be thankful for any type of aid, professional, legal, construction. We will accept everything and we'll be pleased to do this. What is the prospects for the clinic restoration? The movement to the new place and the restore of our work and activities for those people who are in need of that. There is also the queue of the military, who also wait for the possibility to have laser correction of vision in our clinic within our cooperation with the military hospital. Of course, the time frame that I've mentioned is quite optimistic, but we rely upon support of people and on our staff and on our internal initiative. So despite this difficult situation, we're still hopeful, and that in the nearest future we will be able to restore our activity. The situation is very difficult for us, and we understand that for us, this, and actually for the whole of Odessa, this is the most tragic event in the city. But we are calm, and the house, the business center that hosted this center, was like a shield for the houses behind it, thus sparing the people living there. And we are actually happy that that happened as it happened, avoiding thousands of killed people. That's why I would like, and I would also like to thank once again to those who help us. If you need any consultations, we can find my Facebook page, Ruslan Shchipun. You can ask questions, and we are ready to answer questions. We are ready to discuss every possibility and proposal. Thank you. I see that my colleague has a question. Good afternoon, Anatoly Kosin, Media Center, Ukraine, Odessa. And I have a range of questions which are related to numbers, because people love numbers. You've mentioned that you've had modern equipment. Can you speak about the value of this equipment? This is the first question. How many patients are unable to receive your aid now, receive medical aid now, and how many people have donated to you? And if it is possible to say how much money has been already donated to you? Yes, of course, we are ready to share this information. So there are several sources, to some, like Monobank account, PayPal, and also Privat Bank. And as of this morning, we've already raised more than 200,000 hryvnias through Monobank, 26,000 hryvnias that have been collected through Privat Bank account, and around $500 that have been sent by our citizens from other countries through PayPal. This is a huge amount, and we are very thankful to this. And what is the most interesting thing is that, and the sum raised through the small donations, like 550, 100 hryvnias, and this speaks that we have managed to cover a big amount of people, saying that people all over Ukraine care about the situation, and this amount will be spent in the nearest future, and we will report about all the expenses. We will use this money for the initial repair in the premises that we have recently moved into, according to the requirements of the sanitary control and also construction control. There is a whole range of requirements. We need to meet them, so we are focusing on this now. As for the patients who still waiting for treatment, we have around 300 people of civilians in a queue and around 20 soldiers, 15, 20 soldiers who are now waiting to receive treatment. Some of them cannot come to us because of the military activity, and we are negotiating with them. As for the value of equipment, this is this is a very difficult question. Where the people ask this question quite often, and around 30%, 50% of equipment was damaged, and we should wait the end of the expertise, as well as to understand the general loss and the general damage. And if we will get this information, we'll be able to publish it in our on our social media pages. So the amount is really huge, but step by step, we are able to collect money, and we're also supported by our colleagues, by our partners. And I hope that we will be able to cope with the aftermath. And one more question. Have you addressed insurance companies? And I understand that this is like force majeure because we have the war. We had a representative of insurance company who told us about some war-related programs. Perhaps your insurance company offered their help to you. The biggest part of the expensive equipment was insured in our center, and the insurance agent was the first person I contacted the next day after the attack. And unfortunately, this is considered as the military risk, and unfortunately, it is not covered by the conditions of the contract. Unfortunately, this is our reality. And it is difficult now to get a loan because of the war without proper deposit. We've addressed several banks, but this will be a long-term process. And this can't help us with our urgent needs because we want to restart our work as soon as possible for the patients who have urgent needs now. Thank you. We have one more question from Facebook. You've mentioned about surgeries for the militaries. What were the conditions? Who paid for these surgeries? And how many operations have been conducted? I can provide precise data on our Facebook page because we need to check this information. But this is quite a big amount. Some surgeries were fully free of charge at the expense of our ophthalmology center. Some surgeries were covered through the sharing system. They were partially paid by volunteer foundations or NGOs and also our servicemen, and they were partially covered by our clinic. And also, some trauma cataractors were also covered by us. Thank you. Thank you for being with us today. Thank you very much for the possibility to be here today. That's it for now. The next briefing will take place at 2 p.m. and it will be dedicated to admission campaign of 2023 under the martial law. Stay tuned.